Hello, social workers, mental health professionals, and change agents. Welcome to another episode of season 8 of the Social Work Branch podcast. I'm your host, Bash Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to the podcast. I appreciate all love and support. Gracias a todos por su apoyo. This podcast is brought to you by Bass City Entertainment, doing business as Bass Moreno Consulting, focusing on financial education and stability for people of color in the sandwich generation. For more information, go to bassmoreno.com. Um, and yet, I'm doing assessments and things of that nature. We need to talk about money in our community, and because statistically we are behind in terms of generational wealth and creating wealth for our families and leaving a legacy. So all that it is extremely important. And also is May's Mental Health Awareness Month, and of course I'll be promoting my poetry book, Trying Through Pain: How to Maximize Your Full Potential in Hard Times. Talk about grief, loss, anxiety, self-awareness, financial education. Things are not normally talked about in our Black and Brown communities. Is available on my website and also on Amazon. So a lot of things are happening this month. You can follow the podcast on all social media outlets, on Instagram at the Social Work Rants Podcast. That's all one word. On Twitter, X at Social Work Rants, and hit the like button, type in the Social Work Rants Podcast on Facebook, aka Meta. And of course, the YouTube channel, hit that red subscribe button, subscribe, watch the videos, like them, and also on all your platforms, uh, rate, subscribe, download podcast episodes. It's available on all audio platforms, as mentioned before. So, my guest is at this time, Norma Garcia, LCSW. Uh, we connected through Dr. Letty, who's been on the podcast a couple times, and one of my co-authors of Latinx Social Work Volume 2. So it's great to connect with you. How are you doing today?
Same. Thank you. Yeah, thank you for inviting me and having me on here. I'm doing good. Hopefully you are too. Sounds like you are. You're doing a lot of things in our communities. So I love that. Love to hear that.
Yeah, I'm trying. I'm trying to infiltrate the streets of Delaware, and it's hard, but I'm trying.
Yeah, that's all we can all do is try. And I think that's what we're all just trying to do as social workers is trying to be agents of change, even if it's just a little bit.
No, absolutely. Before we get started, this episode is not, well, the podcast is not to be used as a substitute for individual therapy or counseling. If you need assistance, by all means, if you have a therapist, contact your therapist. If you have a psychiatrist, contact your psychiatrist. Call 988. If you really are in trouble, call 911. Go to your nearest emergency room. It's okay not to be okay. Every month is mental health, should be mental health awareness month, and get the help that you need, and it's okay to be okay. And we got a lot of great therapists of Latino descent, a lot of people of color doing amazing work in the field, and definitely get the help that you need. So Norman, how, let people know who you are, what you do in our wonderful, challenging field of social work.
Yeah, absolutely. So my name is Norma Garcia, and I am a licensed clinical social worker, and I'm also a registered play therapist. And I founded a group practice called Centro de Consejería Familiar, and we are all social workers. Except right now we have an intern who's an LPC intern, but other than that, all of us are social workers. I work very closely with UTA to get field practicum students and their masters internships to work with us and help provide services for our Latino community. I purposefully named the centro, Centro de Consejería Familiar in Spanish because I saw obviously a need for in our Latino community for Spanish speaking families who were having a difficult time finding services, finding counseling services in their language, right? Someone who looked like them, who culturally would understand them. And so I think that was where my niche was. Like, I wanted to serve the Spanish speaking community and make sure that they knew that there were providers that could help them in their own language.
Awesome. Where are you located at?
So we have an office. We are in Arlington, Texas, which is part of the DFW area. So we have an office in Arlington, which is in Tarrant County, and then we have an office in Duncanville, Texas, which is Dallas County.
Oh, nice. Um, yeah, so has a business owner, like how is it has it been for you, especially when all the stuff that's happening with Governor Abbott doing Governor Abbott things.
Absolutely.
How's it been, business wise? Like, what are you seeing with the clients? Like, what is happening? I guess it's like three part question. Like, what are you seeing that in your area that's not that we won't see on the news that need to be talked about?
Oh, yeah, absolutely. Well, first of all, I think maybe we did see this in the news that a lot of our families lost Medicaid coverage, right?
Mm,
I am a Medicaid provider, so I'm able to see client. And so a large percentage of my clients lost their coverage. And it was really difficult to see, right? That these families who are working hard, and I mean, I guess I necessarily didn't pry or know exactly why, but it was just surprising how many families were kicked out of the Medicaid, no longer had coverage, and were no longer able to receive, or it had their services interrupted, right, for
mm-hmm,
a certain amount of time. So that affected me as a business owner too, right? Not having that income coming in, the client when my caseload was a certain number, and that there was a decrease. Um, and so I think that, and I continue, one of the things that I continue to see is just the need. It's really hard to say no or to say, hey, we have a 6 to 8 week wait list right now to get you in for therapy because there's such a need in our Latino community, because they know that we're Spanish speaking, because there's only a limited number of providers. And obviously we can't work for, 100 hours a week all the time.
right.
So I think there's just those are the things that I noticed as an entrepreneur, definitely noticing that my caseload dropped, but gracias a Dios, there was a wait list. And so we're able to get more clients in and help people. But it was sad to see for other clients who were unable to, you know, cover their sessions, and therefore their services were interrupted. And of course, we did our due diligence. Anyone who needed something that we could not interrupt their care, and then continuity of care was very important. We continued to see them at um, low cost fees.
Yeah, and for people who's watching this or listen to it, I mean, I've spoken about this quite a bit. The national COVID emergency expired last April of 2023. So so and it's been a complete disaster in many fronts. You just mentioned, you are providing services for Medicaid, and so you lost business. Clients lost their coverage. They need services. Like, luckily, you're able to do to still try to see them for low cost, but at the same time, this I was trying to talk about this quite a bit, getting people prepared for therapists like yourself, who or anybody who in the social service field who are billing Medicaid. Like, be on the lookout. A lot of people are going to get their Medicaid cut real quick, and there was a huge between Texas, Oklahoma. I saw in the news a lot of people, like thousands of people, like within like the first month after the COVID emergency ended, just automatically got cut. Where I work at now, full time, I constantly, like, I'm always have to look at our DMAP situation, just the website for to check people's Medicaid status, just to kind of get ahead of the curve, and like, oh, did you recertify? If you didn't, okay, let me check on the website to see if you still got coverage. And so we kind of, it has been ongoing, and not only the local level, but for me, like the federal level, has done a terrible job with the messaging and letting people know that this was happening, and it's unfortunately, this stuff that has happened is continuing to happen. People are still getting cut left and right. Like, it's been a full year, and states are struggling to do the recertifications of who needs to be who overqualifies for Medicaid, and people are getting cut, or people need to reapply, or there's other people who got automatically got recertified Medicaid. So it's been a whole shit show for lack of a better word regarding
Absolutely.
Medicaid.
Absolutely. And our families are, I think about our Latino Spanish speaking families are the ones that are most affected, are the ones that are
Mm,
most affected. I think about maybe our parents are undocumented, but the children are documented, therefore they qualify for Medicaid. But, due to the language barrier, due to their finances, I always think a lot of our families are trying to survive. They're working,
mhm,
they may miss a letter, or they may not have, maybe filled out the application on time that they should have. And so I think that they experience unique barriers
mhm,
to this, and I feel like they get punished, for things that they can't necessarily always control, right? Or it's like we get punished for only speaking Spanish, or they get punished for, having to survive and work. And oh my gosh, they don't have fax machines. How do they fax over an application? So as social workers too, I know a lot of times, like with the interns that I have, like I say, you may spend a session. I would always tell them, you may spend a session helping them translate forms, helping them fill out an application. Like, and that is okay. Like, that is still part of like a therapeutic process, is
mhm,
empowering them, teaching them, educating them, and helping them, because otherwise there are limited resources, or they may not know where to go, or we are the first point of contact. And if we can spend 20 minutes filling out a form during our session, there's nothing wrong with that. So I feel like, our Latino community has those special, just issues that they deal with, and not everyone does. And it was funny that you mentioned about verifying, because I had a family who just recertified, right? They just reapplied and they said it's active. And like in April, the last week, it still wasn't showing. So they came to see me. Hey, and I was like, hold on, let me check your Medicaid. Because one of the things that I dislike, because I mean, I trust them, and I'm in a helping profession, right?
mhm,
And in the end, like I said, as an entrepreneur too, if I end up losing money, then I just want to help. I want to help this family. It's just one client, right? I think about
right.
if I don't get paid, but I was just like, I would hate to say, hey, well, I saw you 4 times and, trusted
Mhm,
that you did recertify, but it wasn't effective. So
right.
I think that, so thankfully it was. But I just think about, those are things that we also have to do as social workers. You do that a full time job. As an entrepreneur, I have to run in there. Let me check really quick on this Texas state, website, and make sure your insurance is active.
No, yeah, and even for I work with a lot of the undocumented, and like you mentioned, like we come into the country, we just trying to survive, and like literally, like we might rent a room or like nothing. We have nothing in our name, like or like we share. We might rent an apartment with other people, like, and we like living renting a room in an apartment. So it's like who's that we're like asking people, okay, we need something. Who you paying the rent to? Like, are you getting
Yeah.
receipts and stuff? Because Medicaid is asking for this stuff, and they don't have that
Yeah.
documentation is to no fault of their own. So it's like, but Medicaid is asking for it for our Medicaid application. So it's like there's a lot of these things, like these little details, and try to get services and like where to go. And like you said, we're usually like the first point of contact. And your obviously your role and my role where I'm at right now, I can't literally take the client myself and like take them to where they need to go and just sit there and handhold. There's only so much hand holding you could do.
Yeah. And I'm gonna go on a rant too, but I was thinking that what our Latino families also face is that fear, right? Is that
Hmm.
because our parents are undocumented most of the time, and the children, they still choose, there's so many children that qualify for some type of coverage, but the parents are so scared, right? They fear possible deportation, or,
Hmm.
it's gonna have a consequence. They're just uneducated about the process, and knowing that, or they're being told, oh, if one day you do, vas a poder arreglar papeles, like, you will be able to
Yeah.
maybe get up, but if you apply for Medicaid, you won't, so it's like, well, so it's just educating them about that.
Right.
But, just doing a lot of research about that recently, and realizing that there are so many children that do qualify for coverage, but they don't have it because parents are scared. Our undocumented Latino families
Hmm.
are scared to apply. They think there's consequences. They think they don't qualify. So there's a lot of, just misinformation or lack of
Absolutely.
information and knowledge regarding the issue. And I know one of the things that I always tell my clients, even with Medicaid, they're like, well, do I need a referral? Well, I don't know what it is, how it is in different states, but
Hmm.
here, I was like, you don't need a referral. You can self-refer, and you get a certain number of sessions, right, per year. And so, I've never had a situation in which I've ran out of sessions throughout the year. But if we run out because your child needs extra, help, or, they need to be seen twice a week, I was like, there's also ways to request more sessions if we were to run out, so
Right.
I think that that's people don't realize that, like, oh, Medicaid covers counseling. Like, oh, I don't need to go through 10 steps to get a referral to do this, to do that.
Hmm.
At least not here in in Texas in DFW. Anyways, we don't need
Gotcha.
refers, and they can self refer.
So working with the population that you do, I did want to touch on Governor Abbott and his like what like for me, like I'm trying to think ahead with the clientele that I see, because there's potentially a lot of changeover. I live in Delaware. We got a new governor that's happening. The town that I work in might have a new mayor. There might be a new U.S. senator. There might be at least one new state senator. 2025, if they get their stuff together, marijuana will be legal. It's technically legal now, but they're setting up the people get licenses and stuff like that, trying to do all the proper channels and stuff like that. So there's money coming in eventually into the state. What they're going to do with all that money? So there's a lot of changeover that's happening, and of course we have Agent Orange and President Biden seeking office for president. So potentially we might have a new president again. So all these changes happening, there might be so preparing patients. You know, any services you having right now, come this time next year, it might be totally different, and start preparing yourself now for any possible change. So someone like Governor Abbott, who's been doing a terrible job, shipping people to New York and all these different places, and like what's happening? How's he affecting like how you do business with the clients you serve?
Mhm. Well, I have to be completely honest to say I'm not necessarily up to par in my knowledge regarding
Gotcha.
regarding like politics and stuff. I
Yeah.
feel like I focus definitely on my one-on-one with my clients, but I do see the effects of it. My client, I'm always like, I don't watch the news because it gives me anxiety.
Mm,
But my clients tell me, oh, I find out all these new things in the set in sessions, or or talking to parents before I see their children in the waiting room. I know what I do hear a lot of them saying, a lot of, like I said, fear-based irrational thoughts, right? Or like,
mm,
I don't know what could happen. I'm scared, I may be deported, or what if they catch me driving and I don't have a driver's license? Like, or we heard a family of a friend of a family member, this
mm,
happened to them. And so I feel, or I see, and I see the fear, increased anxiety. And so as a clinical social worker, right, my job is to help give them coping skills and help them fight those irrational thoughts and come up with a plan, right? Let's think about the worst case scenario,
mm,
unfortunately, because those are things that we cannot control,
right.
statuses or things like that. So I think that's just what I find things out through my clients, and they share those things. I do need to be better about that though, just a little bit. But
But
I
it's
do.
funny. But it's
Uh-huh.
funny you mentioned that, because I literally just did a podcast episode to like, if watching the news is not your thing, like you protect your mental health at all costs. And even you go on your phone, you go on like Instagram, and you might see like a video of police brutality. Like first thing, you wake up in the morning, you go on this scroll on Instagram. That's the first thing you see. Like you just like wake it up for your day. So it's like protect your mental health at all costs. So it's like, watching the news could be. I just watch the sports, watch news, or watch the weather for the weather, and
Yeah.
go about my day.
I know it's really different for sure. I mean, and I know myself. Like I know watching the news gives me anxiety. I think about when you were mentioning COVID. I think about during COVID, and if anything that would come up, yeah, I would go through it because as soon as I read it, I feel my heart racing. I feel these things, and I remember even during that time doing sessions with clients in person, and we would sit down and do like almost math in our dry erase board, kind of like, okay, how many people live at DMW? If 10% people get sick, like I mean, I did those things in hopes of like also teaching clients like your fear is a bit, irrational. Like there's only a small percentage of people that are being, you know, severe consequences of COVID, so trying to help them, challenge those fear-based thoughts and continue to cope with it and be a little productive, right? Even though we were in the middle of a pandemic, but it's so difficult to be in situations like that. Of course, validating their fears, but also, helping them challenge that so they can continue to work through our day-to-day activities.
Right, of course, because you could literally be paralyzed in fear, and you're just stuck, and you're not able to do anything. And now, fortunately or unfortunately, life just like it keeps on going. Whether you stuck, life is going to keep on going, and you're just going to be just stuck, unfortunately. And yeah, these coping skills are really much needed. So, like you said, so um, so how was COVID? For you, like as a clinical social worker providing services, for the patients.
I have a funny story because I'm a registered play therapist. So I always talk about that. Gracias a Dios, I was still busy, right? But let me tell you one time what one of my parents said. They came in session and it was during the pandemic because I was like, I cannot stay at home. I'm going to go to the office. If you want to do virtual, we'll do it, but we'll try to stay. We'll wear masks. We'll protect ourselves. Use our gear and stuff. But I remember when I'm saying, well, it's because we're locked up at home all day long, not doing anything. So I'm just going to bring them to play with you, right? And for a moment, I thought, for a moment I wanted to personalize it and be like, we're not just playing, like
Right.
but she was like, we're just gonna go and play with you so they can get out of the house. And I was like, okay. It was just funny. So I think about gracias a Dios again, like I said, I had a lot of work. My clients came to see me, maybe because there was no school, maybe because I was the only outing they got to do once a week. And so yeah, so thankfully I still had a lot of business and kept myself busy during that time.
Right.
And I
Well,
saw
that's
my
good.
clients. So
But,
yeah.
but it's funny you mentioned because uh, I've heard clients I used to work in foster care and be like, all they and having like parents or foster parents be like, all they do is play. Like it's like it's not the real therapy until like years later. I actually like read a book about play therapy. Is like there's actually scientific. No, it works, and is like you say, not just playing, like providing a therapeutic
Yeah.
approach to these kids. But it's funny, like for people
Mhm.
outside who don't know that knowledge, but like they just playing. Like what's
Yeah,
the what's the therapy with that? Like they're not getting better.
absolutely. Well, and it's funny you say that too, because I think that part of my job is educating my client and my parents, about what play therapy is, right? And
Hmm.
and I remember, there's other times parents, again, because I think about I don't personalize it, even though I'm like, I just spent a whole hour teaching you about play therapy and our intake, and you still don't know what it is. I don't say that to them ever, but because sometimes the parents will come in and they'll be like, well, the teacher says they've changed. I don't know what you're doing in there, but it's working because now, he's not doing this or he's not doing that anymore. And I was just like, I'm glad to hear that things are better, but it's like, again, they maybe they don't understand the scientific part, of in the clinical part of how powerful play therapy is, right? And what we do in the playroom. But absolutely, I just love working with my parents, and I never take anything personally. I know, I mean, I'm a Latina too, right? And I'm sure my mom, who has a daughter that's a clinical social worker, always talks mess about what I do, So I'm like used to it. I'm like, and I know they don't mean it in a negative way, but it's just
Right.
it goes back to our culture, like what they believe, and they trust the process. They know that it's working. They're like, I don't know what you're doing, but keep doing it. I'm going to keep bringing him, because it works, so that's the power of play.
Yeah, and it's funny how like our culture plays such a big part, and I'm glad that you have such success, with work, because obviously there's always the stigma that plays in. Oh no, we don't go to therapy, we don't talk about our feelings, and a lot of older, like I know my dad is like, I know I got and I'm nervous, mucho nervios, and like, all right, that's called anxiety. Like, you need to talk to somebody. And it's like, no, 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 no quiero hablar de mis sentimientos. Talk about feelings and stuff like that. I can't. Oh, well, I'm. You can only talk to me up to so much. Like, I need.
Yeah.
We got to establish a boundary. So.
Exactly. It's funny. I remember my mom, a similar situation. My mom, something she was going through something, and I just said, "Well, mom, I think that you should talk to a counselor about that." Again, because I'm her daughter, I'm biased. I'm not going to give her an unbiased opinion because I have feelings for her as my mom. And I said, "You should." And she's like, "¿Qué me va a enseñar ella? ¿Qué va a da, da, da?" Like, I mean, in other words, she's like, "What is she going to teach me?" Like, in, and I just looked at her like, okay, mom, but it's like we think about again the stigma of what they believe, and so we continue as clinicians challenging that. And I think that in my work, I think one of the things that have has helped me be successful is the relationship that I'm able to build with the parents, especially because we work with children. Like I think when the parents, I keep it real, they see I'm Latina. I can share personal experiences, or I try to just really connect and have that empathy. Like I know how hard it is. Like it's okay. Like I get it. Like it is challenging and it's not your fault. And so just giving them that validation, connecting with the parents, um, is really like just a part of being a clinician and working with the Latino community. The most important part is that chit chat before we take the client into session, right?
Right.
I come out of my office, I come out to the waiting room, and I'm like, oh, ¿cómo están? Sometimes they bring me a donut, not a donut, pan dulce or
Mm,
taquitos, and they bring, depending what time our session is,
right.
there's always that little chit chat, that 5 or 10 minutes connecting. I've even had kids that are more teenagers, a little bit older. They'll be like, that means I have less time in there with her. Stop talking to Norma, kind of thing. So the moms will be like, okay, Norma, just go with her because then she gets mad at me because I spent time talking to you. But that is important because building
Yeah.
that connection with our parents, accepting that pan dulce, even though maybe our code of ethics says we don't take gifts, right? That's
Mm,
something culturally, that we as Latino clinicians deal with our clients.
right.
That's important, right? Having that chit chat. And like I was thinking just this week, I was talking to a client about fajas, like we're talking about fajas and the teenagers are looking at us like, okay, guys, but those are things that, that I think build that connection and that
Of
trusting
course.
relationship with me. And then, that then I can be a source of education for them to teach them and, talk to them about things that they can do to cope better or handle different situations.
No, that is so not so important, so needed, and especially within our community that we go through a lot, like anybody else, but it's just that couple minutes, even talking about fajas and just anything taking up al dulce or anything, or even when I did home visits, so like they offer you a plate of food or cafe and some coffee or whatever. Like, no, I'm good, I'm good. Like, they come off be disrespectful because you're not taking taking an offer and they're like, I just ate or got a lie or whatever. I'm on a diet or something.
Yeah.
So it's like, so it's things like that that you're building that rapport and building that slowly building that trust and giving them no credit because they're bringing clients to you to understand, like, at least for a child perspective, okay, they need to see the therapist, maybe not for themselves, but at least for the kid. Like, okay, you need to,
Yeah.
yeah, they need to come in for treatment.
Absolutely. Yeah. But then that also helps, like whenever I do need to talk to the parents about parenting skills or I'm doing
Mm-hmm.
parent consultations, the fact that I already have that relationship established, even if it's talking about food or talking about fajas or talking about what they did that weekend, like when I do have to address something, that rapport, like you said, is there, that trusting relationship, and they feel safe and they know that I'm not judging them and I'm just here to help and help them cope with that.
Yeah, that's so important. Now, I love the fact that there's so many, and I've had a few on the podcast, so many wonderful, talented social workers doing amazing work in the Dallas Fort Worth area. Yeah, Dr. Letty and had Diana, I forget her last name, been on the podcast, and there's quite a few people. Uh, and you guys all seem to, from what I've seen online, kind of like still connect and do outings together, and just you're all serving like the same community, and there's like no you, there's enough out there in terms of everybody's getting their money, everybody's able to eat, and like there's no competition. We're just trying to serve the clients. I really like that and respect that, and being able to go to Dallas almost a year ago already, or more than a year ago already, and kind of for a conference out there and doing a presentation and kind of like really see like people coming together and doing the amazing work and serving the community. I really like and respect that.
Yeah, good. I agree. I love that too. I love that. Just, I one of the things that being in a practice, when I started prior practice, before I started the group, I felt alone. And that was the thing. Like I didn't know anybody, any other Latina social workers that, well, other than my friends that maybe I worked with at other jobs, but in private practice that I dealt with, that I could, kind of just, I don't know, I just felt alone.
Mm-hmm.
That's the word. I felt alone. So I feel like when I found out about Dr. Letty, like she reached out to me, and I love that because I can be isolating sometimes, and so sometimes I kind of just stay in my bubble, focus on what I'm doing. But when she reached out to me and I got to meet her and meet the community, I was like, wow, there's like so many of us. Like I felt alone, and I didn't realize there were so many. So
Mm-hmm.
I think Dr. Letty definitely has provided a space and created a space in which we can connect. And I appreciate her for that. And absolutely, it's value collaboration over competition. I never, I refer clients to Dr. Letty. Like some of my clients, I'm like, hey, we can't provide the service, like, to this family member, but maybe you can. Like, absolutely, I'm like, there's more than enough. There's a lot of people in DFW, and we don't have to be like that, right? I just think that, and so I value absolutely the collaboration that we have in our community. With clients or with families or with each other more than anything.
Right. And that's a lesson for anybody that's out there that watching it. It's the need in terms of mental health, especially before COVID and even now, especially whatever this aftermath of post COVID, we're slowly seeing what it's like, and kind of there's still a need. People still need services, and obviously we may have to do a little bit extra work for those who qualify for Medicaid and doing all that work. But if they have private insurance, you take it, or cash, whatever. There's the need is there. You're always, whether good or bad, always going to have a client
Yes,
to serve.
absolutely. Yes. Mhm.
What are what's some goals you have for the rest of 2024?
Oh man, I think that that's a really good question. First, I was going to mention something that you said. You were talking about finances and creating
Mm-hmm.
generational wealth and all that. I'm doing this program with TWU for women entrepreneurships, and I was chosen for the Accelerate Her program. And on top of everything that I'm doing, I'm like, do I have time to do this? But I was like, I have to make time to do this. But one of the things that I'm struggling with, that I was actually I'm embarrassed to say, but I was told that I'm not going to graduate this program if I don't get this, is a finance part. And so, because I'm just like, I don't know. I just know that there's enough. Like there's enough to pay everything. And they're like, well, how much is this? And I'm like, I don't know. Like I don't, so it's like understanding. So I think my goal is definitely being able to understand my finance. Like I think in business, like what is a P&L? Like I've been doing private sessions with advisors too, one-on-one sessions with advisors from the program, because I need all that extra help, to figure
Mm-hmm.
that out. I guess they were like, "Wow, well, you've made this work." They're been in practice so many years, and you've made this work, and you don't know any of this. And I was like, what are my projections? What are my things? I was like, I don't know. I just every month this is what comes in, and there's enough to pay everything and pay myself, and so pay everybody. So what's the deal? Like, like what do you mean I got to figure this out? Like, but it's so it's really important. That's
Mm-hmm.
something that I obviously as a child didn't I mean, my parents were great, but that was something they didn't teach me, right? So I think that's a personal mission of teach my children about finances, and but the business part, figuring that out and understanding what all these numbers mean, something that I'm working towards. So that definitely to get my I always use the word legit. It's like I want to be legit, and I was like, I've been legit. They're like, you've been legit. You just need to
Right.
you just need to understand your numbers. And I was like,
Exactly.
okay. But it's so definitely that's a goal, making sure that I understand the business part. I've always been like, I see the clients, this is what I
Mm-hmm.
do, this is what I do, but and there's money in there to pay everything and there's
Mm-hmm.
enough, but I don't know what the numbers mean. And so that's a personal, as an entrepreneur, my goal. Um, and for the center in general, is just continue to help create a space for master level social workers to get experience. Thankfully, we've always had positive feedback. Everybody loves, what we're doing, and they love, working with us and create a safe space where they can learn, and we can continue to serve families. So that's one of the biggest things too. I think working with master level students from the universities is that we're able to help more people. That's my goal. I was like, I just want to help more people. When they asked me recently, well, what's your goal for your business? It's like, I just want to help more people. That's all I want to do. Like, it's not about, I mean, obviously I have to make money to pay my bills, but more than
Right.
anything, let's help people. Let's help people. And I was like, that's my goal, is continuing to get the word out there, reduce the stigma, inform people about services, and continue to help them, right? To create change
Mm.
or create awareness about mental health.
No, yeah, and as time goes on, like that need, like I said before, the need is there. It'll continue to be there, and Lord knows what's going to happen come November, and there's even more unrational thoughts and ideas will continue, and the coping skills are definitely need to be put in place, and it's just a lot happening all at the same time, and we're just one person trying to make a dent and trying to help people best they can.
Absolutely. Yeah, absolutely.
Where can people find you?
So on social media, we're it's really well, our whole name at Centro de Consejería Familiar. So we have Facebook, Instagram, and some TikTok where I do some parenting tips on there. I even have videos of me and my well, back then he was younger. He's 7 years old now, but me doing parenting. I think I was like, I have, well, I'm gonna tell you in person. I have three children. They're two adults, they're 21, 20, and I have a 7 year old. But I was like, God, all of this happened. Like I have this child so that I could continue to connect with my parents and talk about the difficulties of parenting because it is so hard to be a parent.
Hmm.
And so I think a lot of the times when I deal with my child having emotional dysregulation, I've used some of my videos or some instances in which he's lost control to kind of like model that for my parents because I'm like I go through it too, even though I'm a play therapist and a clinical social worker. Like my kid throws a fit at the store too and embarrasses me in front of everyone. So it kind of like, anyways, I feel that helps me connect with them too. But absolutely, it's Centro de Consejería Familiar. And when we do parenting tips, we provide information, mental health awareness, and stuff to just educate people about mental health and counseling services.
All right, awesome. Uh, keep up the great work. It was great connecting with you, and let's stay in touch.
Thank you. Absolutely. I appreciate you having me.
Absolutely.